Hi, I'm Janice Colwell, and the module today that we're going to go over is pouching systems. In this module, we're going to go over application and indications for pouching systems. But I thought we should probably start by a definition to be sure you know what we're talking about. So a pouching system are the products that we use to contain and collect the stoma output, and they also provide a predictable seal, meaning they're going to protect the peristomal skin and not allow for any leakage. So usually it's two things in a pouching system. It is the skin barrier and adhesive, they go hand in hand, and a pouch. And there is a variety of pouches. We'll go over several of them now. Before we do though, I want to just talk to you about the principles when we choose a pouching system, kind of what our objectives are. We want to help our patient get what we call consistent wear time. That means that they put it on one day, they take it off another day, and in between that time there is no leakage. So they have security. They know they can go out and about with their pouching system and not have any leakage. But at the same time, we need to protect that peristomal skin. When we take the pouching system off, we want to know that there's no damage at all. And then the third thing we have to consider when we're choosing a pouching system is, what does the patient want? And usually at the beginning, when a patient has a brand new stoma, they're not quite sure what they want. They'll probably want to try a few different things. So it's up to us to help kind of pick and choose which ones might be appropriate for them, but finally it'll be their decision with us. So when you're trying to determine what type of pouching system for your patient, there are many things that you need to take a look at. I mentioned to you the patient. You need to look at the type of skin they have, the type of stoma they have. What does their peristomal skin look like? What does it look like when they sit, when they lay? Are there creases? Are there folds? Is there already some skin damage? And then you also need to take a look at what the patient's able to do. Are they able to open and close the pouch that you think is the best for them? Is it a pouching system that needs scissors to cut an opening? You need to know what their abilities are so that you're choosing the best pouch for them. So let's look at the components of the pouching system, and I think you can see it pretty good here in the slide. This is the skin barrier adhesive, and you see it right here. It is the section that goes right around the stoma. It should fit directly around the stoma so that when the stool or urine comes out, the output goes directly into the pouch, and that's how it protects the skin. So every pouching system has some kind of an adhesive, usually called a skin barrier, may or may not have a waterproof tape around the edge, and I'll show you a couple of those in a minute. And then the second portion of the pouching system is the pouch itself. That's the odor-proof plastic pouch that collects the stool or urine, holds it until it's convenient for the patient to discard. And every ostomy pouching system should be odor-proof. You should not be choosing anything that isn't. Okay, so let's drill it down. Let's take a look first at the skin barrier. I mentioned to you that the skin barrier gives the adhesion. It keeps the pouch attached to the skin, and at the same time it protects the skin. So look at these pictures. You can see a skin barrier here on a pouch. This is called a one-piece pouching system because the skin barrier is attached to the pouching system. This skin barrier is also available like this, separate from a pouch. So we call that a two-piece pouching system. The pouch snaps on top of the adhesive. You see this flange right here. This is what the two-piece system is. It means the pouch will snap on top of it. Now this is a skin barrier and this is a skin barrier. They're absolutely the same. What's different here is how the pouch attaches, and I have a couple slides in a few minutes that may clear that up a little more for you. But in terms of skin barrier products, there also is what's called accessory products. Those are items, as you see listed here, that can enhance the seal, make it even better. So this is the skin barrier, but it also comes in a paste. It comes in a powder, it comes in ring and strip, and I have a few slides that will show you how we might choose to use each one of those. Now let's dig a little more into the skin barrier, and the skin barrier itself is a hydrocolloid. Now why is that important? Well, a hydrocolloid absorbs moisture, which is important. You can't have an adhesive seal on skin that might sweat and not absorb moisture, because if you did, the skin barrier would not be able to stick. So a hydrocolloid, hydro meaning liquid, pulls fluid into it. So what happens is it not only pulls the skin, here's the hydrocolloid right here, skin moisture, but it's going to pull some of the moisture from the stoma. So when I take off a hydrocolloid / skin barrier, you see right here, this is the back portion of it. Do you see the moisture that it absorbed from around the stoma? And you can see that it's almost turned a lighter color because the moisture is now into the skin barrier. But remember what the skin barrier is? It's got adhesive. So when there's too much moisture in a skin barrier, it's no longer going to adhere. So we have to decide how long we can keep the hydrocolloid skin barrier in place before there's not enough adhesive and it will either loosen or allow the stool or urine to get underneath it. And that's what would have happened with this one if it stayed on much longer. Now the good news is there's tons of options for us. There are regular wear, meaning for someone who doesn't have a lot of moisture from their stoma, maybe someone with a left-sided colostomy because they have a pasty stool, or extended wear will last even longer in the presence of moisture, such as a urostomy or a ileostomy. And then there's a combination. Some of the products combine them both, and some of the adhesives even have certain things infused in them to try to make them skin friendly. Maybe a little confusing, but I think as we go on, you'll see the difference in why you might choose each. I think it's good news, though, that we have all these different types, because think about all the different types of patients that we manage. We can find something for every one of them.